Right now, we are in the winter months, and public health experts want everyone to be aware of what they're calling a quad-demic, and it's hitting communities across the nation. With us this morning is Dr. Wes Stubblefield with the Alabama Department of Public Health. Good to see you, Dr. Stubblefield.
Good to talk to you.
All right, so a quad-demic, what are the four viruses we're talking about here?
So right now, what we have circulating, and we have data from CDC and from ADPH, are the COVID-19 virus, the RSV virus, the influenza virus, and then we've also heard of reports of norovirus that's been circulating.
How is this affecting Alabama? I was reading in an article out of North Carolina that some of those hospitals are actually limiting visitors because of all of these viruses this time of year. How is it affecting us here in Alabama, particularly the emergency departments?
So the Hospital Association may have information on that. We don't get information about the status of our hospitals. What we do get are some information about discharge diagnoses from emergency departments. And right now, about 10% of people are being discharged with a diagnosis of either COVID-19 flu or RSV, primarily flu.
What are your concerns now with kids getting back into school after a long, holiday break for Christmas and New Year's? And I guess we're seeing a spike in cases too, possibly after families get together for holidays. What are your concerns as a doctor?
So really what we are most concerned about are those that are at high risk for severe illness. And severe illness would be illness that most often leads to hospitalization and can, in certain circumstances, lead to death. So we think all the viruses are a bit different, but generally what we would see is those on the extremes of age, so the very young and then older individuals, particularly frail individuals, those with underlying medical conditions like heart or lung disease, and those that have compromised immune systems, and potentially even pregnant women. So we worry about these categories in general. Although anyone can get severely ill, these are the ones we worry about, especially as we move into this high point of respiratory illnesses. And we know that children do get sick at school, and then they do bring things home, and then they interact with potentially family members that may be at high risk.
What's your message to everyone as we navigate these viruses that crop up this time of year? I'm sure a lot of people with vulnerable immune systems will stay home or stay away from groups of people. What do you want the rest of us to do and to know?
The main things we talk about will be primarily the same as we've talked about for several years, potentially after the COVID-19 pandemic. Using good respiratory etiquette is very important, so coughing into your elbow, keeping your hands clean. It's also important to stay home if you're sick and to follow recommendations about going back to regular activity, which is generally around 24 hours after your fever has subsided without the use of any sort of fever reducers and you're feeling better. Those are usually good signs. Being cautious around those who are at high risk for infection, and then, of course, considering vaccination for those that have for the diseases that we have vaccines for and what you're eligible for. Even in the middle of the season, it's still recommended.
I still see a lot of people coughing into their hands, sneezing into their hands. You got to use this part right here. You're just spreading it even more. Dr. Wes Stubblefield with the Alabama Department of Health, thank you so much for joining us this morning.
No problem.
As we head to break, we say a special good morning to Brookwood.
Dramatic.
Is it Brookwood? Trying to read the sign with my bifocals. There you go. It looks lovely there right now, doesn't it?
Yeah. Love that coming up. Yeah, good morning.